How is Johns Hopkins using predictive analytics to uncover the reasons, the why behind a patient's behavior, particularly when it comes to something, let's say, med adherence? How do you know why Eric is not taking his meds?
There's lots of data out there, but we still don't know a lot about who people are, what they're doing, and those kinds of things. We have this modeling and we're getting more into it and it's giving us insights, but there's still missing information. And a big thing that we've been doing is with the data that we do have, building more of these models, but we're still seeing so much value internally with our human analytics team interaction with the model results. And so it's taking what the model does and digging into curiosities and saying, where does that lead us, partnering with other parts of the business to see like, okay, here's what's happening. As an example, this past year, our organization invested in a new initiative with a vendor partner on member outreach for med adherence. So we wanted to reach out to members to make sure they're filling their scripts. Our actuarial team created a wraparound but prediction model to support this around at any point in the year who's most likely to be non-adherent. So this allows us to really prioritize who should be submitted when, first, second, third, et cetera. So that kind of creates that aspect of informing the strategy. But so we also developed a monitoring model. So this was important for us to understand how our outreach was working through the year. And because we had a new strategy this year, we knew that the projection model we had last year, the seasonality patterns, those weren't going to be predictive for us. So the team really needed to more deeply understand the various sort of member journey lines, right? You fill a script, what are the possible things that can happen? What are the probabilities of those? So they created this complex decision tree model. And fundamentally, what that gets for us internally is an answer to the question of, is our current outreach strategy going to get us to our goal? Or do we need to pivot or supplement in some way? And there's such a small margin of error on these measures. Sometimes these critical insights into the why and what's happening can really be the difference between a 3, 4, or 5-star performance.